Is he in the hall? Okay, the next person is the Chief Impact Officer and Group Head, Development Effectiveness Strategy and Research Division, Bank of Industry, Dr. Uche Nwachukwu, who is ably represented by Abu Sufyan, Ibrahim Mahmoud. Is he here? Okay, thank you. Please, can you make your way forward? Please, can we celebrate our judges? It's no beans to make very intellectual decisions like this. And the next member of our jury is the Chief Executive Officer of, pardon me. The next person is the Chief Executive Officer of the Nigerian Solidarity Support Fund, Lagos, Dr. Fejiro Chinye Nwoko. Please, can you recognize her as she makes her way to the front? Okay, thank you so much. And we'll go right straight into the presentations. We have, like I said, 5 finalists, and they are going to be scored on a matrix that we're going to show on the screen, but for want of time, I'd like us to go straight and take the first presentation. The first presentation will be from Sonia Olu Motunrayo. Our innovation is called NeoBlanky, AI-enhanced neonatal care system. Motunrayo, can you make your way forward? Can we appreciate that she makes her way forward?
Sorry. Okay.
Where is your presentation? Yeah, can you identify? You slide.
Good afternoon, esteemed judges, ladies and gentlemen. My name is Motunrayo Sonia. I have an aunt that was married for 7 years before she was able to have a child. And then she lost this child within just a few days. How, you ask? Because the child was born prematurely and didn't have enough fat to produce the heat it needed to survive. So the baby quite literally froze to death in our own home. Now, this is not a very unusual problem, as Nigeria ranks first when it comes to neonatal mortality in Africa. That's the death of a child before the age of 28 days. So this particular incident was what motivated me to create NeoBlanking, a blanket that saves lives. So a major percentage of this neonatal mortality in Nigeria is caused by premature babies that have hypothermia. That's cold. That's when the baby's body temperature drops too low. So we went to the Lagos University Teaching Hospital, and we spoke to a doctor who highlighted some key aspects of this landscape. First off, incubators are very, very effective ways to counter this condition. However, many families, many low-income families and mothers cannot afford to keep their babies in incubators for that long. Then also, it's the fact that there are so many hospitals that can't even afford the cost of incubators in the first place. So when they're transporting the babies to bigger hospitals like Luth now, the baby loses a lot of heat, and in this process, there's not really much that can be done for it. That's when most of the damage happens. So the solution to this is a product called NeoBlanking, that is a warming blanket that solves the issues that I previously highlighted. So it produces the heat needed for the baby to survive. It is not reliant on NEPA power. Then it is powered by solar rechargeable batteries. Then it is also portable, can be used for transportation, and it is also reusable. So the incubators in question, they cost from $2,000 to $20,000, while NeoBlanking comes at a modest cost of $60. Now, our major target audience would be communities, low-resource communities that are going to be facilitated, the payments will be facilitated by NGOs and government organizations, then also families that have premature babies. NeoBlanking is going to be part of a care package for some of the equipment or some of the materials that you take to the hospital when you're about to give birth. Now, we've made some strategic partnerships over the years. We have a partnership with the RISE 360 Institute for Global Health Technology, then also the Lagos University Teaching Hospital that have helped us produce our MVP. Right now, we have our MVP already ready. Then we understand the landscape that we're building for. So a major advantage that we have is that first off, all the materials that we're using for Neoblanky are locally sourced. So we got all of them from Nigeria, mostly from Lagos actually. Then also it is powered by renewable energy. We know that there's no constant power supply in the country, so we're building it based off that. It does not require constant power supply. So our team is made up of some specialized engineers, a product lead, then there are also medical advisors and consultants. Now, what we're asking for here really is a chance to save the future of Nigeria. And we can achieve this, or we can at least start with a modest cost of $40,000. This is going to cover the cost of clinical validations, the cost of getting some specialized equipment to produce Neoblanky, then producing about 500 units of Neoblanky, then also forming strategic partnerships with some of the organizations that can help us push our costs. So we're here fighting for the future of Nigeria. I want you to join us on this cause, to fight with us for the future of Nigeria that are babies. Thank you very much.
Can we give Motra a round of applause? Please, can you come? Thank you. You can stand by the side. Our next innovator I'm going to call is Emmanuel Ejike. Sorry, Abib Olawale Akinshola. Please, can you make your way forward? His innovation is Abiyamo solar-powered infant incubator.
Good day, distinguished guests and panel of judges. If I should ask how many of us has had a newborn baby here, or know someone who has had one, that's virtually everybody in the hall right now. And we all know each moment spent with a newborn feels special. Do we know how long it takes to give a Nigerian birth to a newborn? I mean the one where they massage their bodies and stretch their tiny hands and legs. I'll say 15 to 20 minutes, right? Well, do you know in that 15 to 20 minutes it takes to care for one healthy baby, 25 to 34 preterm babies have lost their lives because every 3 minutes, 5 preterm infants die, with a good percentage occurring in sub-Saharan Africa. I'm Habib Akinshola, the founder of Apex Health Tech, and this crisis pushed me to work on a solar-powered infant incubator for my final year project. And I call it Abiyamo. Abiyamo is a Yoruba word which means one who gives birth, but it's usually used for one considered to be a good, true, and capable mother. This Abiyamo is designed to deliver ICU-level neonatal care. It is constantly powered with batteries and solar panels, has an intuitive UI, and can be locally manufactured. With 8.7 million preterm births occurring in underserved regions and 3.8 million in sub-Saharan Africa. Our market opportunity is massive, and our target customers are hospitals, government health programs, NGOs, and private clinics. Our business model is primarily hardware sales of the units, secondarily services like training programs and strategic partnerships with NGOs. Our social and health impact includes a goal of saving 2,800 lives by our third year of operation, improving equity by giving rural mothers ICU-level care for their babies, and contributing to maternal empowerment. Our team combines biomedical engineering capabilities with technical skills and geoinformatics proficiency for optimal distribution. Next slide. So we are asking for $100,000 over the next 4 years to help us achieve these goals, and very importantly, regulatory support to help us fast-track pathways through NAFDAC, technical validation, and market access through introduction to state health commissioners and international NGOs. The question is not if this is possible. The question is who here is going to join us in creating a future where the 5 preterm infants that lost their lives in the 3 minutes of this speech were instead in their Abiyamo incubator receiving the solar-powered warmth and care they need to survive. The future of inclusive health starts with reliable power. The future starts with Abiyamo.
Thank you. Thank you, Habib. You can step aside. I believe we are enjoying this. Okay. Our next innovator is Emmanuel Ejike. Please, can you make your way forward? Emmanuel's innovation is titled Emo Live, and he's going to be talking about it for 3 minutes. Over.
Good afternoon, ladies and gentlemen. Good afternoon, judges. My name is Emmanuel, and I would like you to help me do something. Please scan the barcode on the screen, and I will tell you why you need to do that shortly. Blood, every human has blood running in their system, about 5 liters of it, and I lost 2 sisters because of lack of it. This is the story of most people in the global south, and that pushed me to become a regular blood donor. And in June 2023, I got a fully funded scholarship to the United States, where I went to the United States for a fully funded scholarship. And I went to the MBSA to make what I believe to be my final donation before I japa. And that was where it dawned on me that there was a lot of issues in the process, in the system, because Nigeria needs a lot of blood to be able to live. And as mentioned by one of our presenters earlier today, a lot of maternal deaths happen in the country because we do not have sufficient blood. I talked to a friend and we came up with this unique solution that people have blood, that means they are walking blood banks. So there is no need for a lot of hospitals who can't afford blood banks to beat around the bush, but so we came up with an application, which is what you scan, that could connect someone that is in need of blood with another person that wants to donate blood. Basically, we are matchmaking people with the same blood types. And this happens in real time. So we are launching this app free of charge. So you do not need to have any money to be able to download and use this app. So we're bringing it to you immediately. And we have already activated 300 plus hospitals. Our app is live, as you can see, and we have partnered with a lot of blood banks and relevant blood agencies. So this is the power team that solves it. I am the founder and CEO. We have a technical lead and medical professionals and marketing professionals in the team that helps to drive this vision. So we are asking for the support of everyone because the issue of blood concerns everyone. And we are also asking for support in the form of funding, which will help us in user growth, product and technology. And also, in the next 2 years, we aim that this will help us onboard 30,000 active users, 5,000 plus hospitals, and position for Pan-African rollout. Thank you very much for listening.
Thank you so much. Thank you so much, Emmanuel. I'm not going to make any judgment yet. Our panel, our members of the jury are going to do that. Our next innovator, I'm going to call upstage, is working on what you call smokeless bricks energy solutions. And it's my pleasure to invite Uche Kenneth Udekwe to this podium. How do I change it? Smokeless bricks. Right.
Hello, everyone. My name is Uche Kenneth Udekwe. I'm the co-founder of Smokeless Bricks Energy Solution, an eco-inclusive social enterprise that harnesses clean energy technologies to combat indoor air pollution, energy poverty, and climate change in Nigeria. So, 5 years ago, I lost my dad, and then my family went through this financial challenge. My mom could not cook with gas anymore. She had to start cooking with She had to start cooking with firewood. But anytime I go to the kitchen to try to support her, she's either coughing or complaining of chest pain. For God's sake, I just lost a dad. I wasn't ready to lose another member of the family. But then amidst all this, it dawned on me that this was not just a personal problem. According to WHO, every year Nigeria loses around 98,000 women due to smoke inhaled while cooking with firewood. It is now the third highest killer after malaria and HIV. And then kerosene usage is the leading cause of lung cancer and leukemia globally. Now my question to everyone here is, must our mothers continue to sacrifice their lives in order for them to cook the food that we're going to eat? Of course, no way. That's why we started Smokeless Bricks. We produce eco-friendly smokeless briquettes from agricultural waste, one of a kind. They burn longer than ordinary charcoal with minimal smoke, and then they are way cheaper. And our game-changing innovation, our eco-friendly smokeless stove, are made from recycled metals. They have stainless-built burn chamber that reaches 200 degrees in less than 10 minutes, and enabling 2 times faster cooking. We have also incorporated our TEG technology that converts the heat from the stove into around 30 watts of electricity, which can now be used to charge mobile phones, light to the house, and also for reading at night. And then we're working on our IoT technology to help us track the carbon offset from our solution and also earn carbon credits. The market size is actually very, very massive. $580 million with about 5.3% annual rate. Then we're targeting household in off-grid communities, tertiary institutions, household in rural communities, and NGOs. Our revenue model is simple. We make sales from direct sales of our products and services. We partner with NGOs, and we're also trying to make money from carbon credits. The team is dynamic. Our CEO has experience in biomass production. I'm a certified project manager. We also have a CTO as well as a sustainability manager. We're asking for $100,000 to help scale up our solutions and then reach 100,000 users before the end of 2026. At Smokeless Bricks, our mothers do not have to sacrifice their lives just because they want to cook the food that we're going to eat. Thank you.
Wow. What a pleasant surprise. I didn't see that coming. He has up to 12 seconds more. Thank you so much. Our next innovator is Theophilus Venn, and his innovation is Edwin Edible Cup. Please welcome with me Theophilus Venn.
Good afternoon, distinguished ladies and gentlemen and judges. We've all heard about the saying, you can't eat your cake and have it. But what if I tell you about a cup that you can eat? My name is Theophilus Venn, and I'm the founder of Vent Ventures, a smart agri-tech company that is providing foods that nourishes the body and protects the environment. We do this through our range of biscuits formulated from fresh tropical fruits, which includes carrots, ginger, and even coconuts. We didn't just stop there. We produce an edible cup that is an alternative to single-use plastics. In fact, it is suitable for your creams, your yogurt, your ice creams. When you finish your drink, you can eat your cup. Our aim is to fortify foods with essential vitamins and nutrients in order to improve the quality of lives of women, children, and those in underserved communities. Our world faces a global challenge today. Unhealthy eating habits and poor nutrition, post-harvest losses, and plastic pollution. Malnutrition is a problem today. According to UNICEF, 2.7 million children suffer from malnutrition in our society. And also, mothers have the responsibility of catering for their families and children. Post-harvest losses, up to 40%, are in the communities today and accounts for spoilage, even in our communities. Plastic pollution. About 2.5 million tons of plastic waste are generated yearly in Nigeria, with less than 15% recycled. What is our solution? Our solution is an edible cup. A cup that when you finish your drink, you can eat the cup. We are reducing plastic pollution. We are improving nutrition with the use of fresh tropical fruits. The biscuit market is enormously large, and that is why we are in the market today. We supply these products, our biscuits, into hotels, restaurants, cafes. We do use technology through online and offline engagement, social media platforms, and with partnership with food vendors at a premium price. Our traction. We've been here for about 8 months, and we've been sold over 4,000 units, return 5x on our customers, and we've replaced 2,000 single-use plastic cups within our environment. We are also upcycling the waste from our production process. Thank you very much.
Thank you so much, Theophilus Ver, and that was his innovation on Edwin Edible Cup. Our final innovator is Suleiman Habib, and his innovation is 960 grams powdered egg. He's going to be pitching virtually. Can we have Suleiman Habib right now? 3 minutes.
My name is Suleiman Habib, founder and CEO of Social Country Farm. Most Nigerian children are still suffering from lack of proper nutrients as recommended by the World Health Organization. And most of those children are seen across health policies such as Sokoto State, Zamfara State, and Nigeria State. And most of those children in IDP camp, which make up to 80% of those children, lack the basic intake of protein. We may also notice that eggs cannot be preserved a very long time without delay. That is why we are breaking into the market for that egg form, which can last a very long time without delay, and also can provide 40 to 70% of the recommended egg nutrient intake by the World Health Organization, thereby helping malnutrition. The market's demand for eggs is large, considering the over large population of the nation, growing from 200 million people that need to take protein food daily. This is a good market for us and also enhances greater return on investment. Our business model includes choice ability by providing government officials seeking for opportunity to distribute to school feeding programs across the nation, bakeries companies, food industries, and cosmetic companies. Our health impact is ensuring that children are no longer malnourished by providing the good protein-rich products that they need. And part of our social impact is food security as part of the identity group. Eggs are enhanced better when they powder form. While our economic impact is creating jobs. In our team, we have 10 members of special nutrition areas, and we have 20 youths that serve as indirect employees and serve as our marketing consultants. We are seeking funding of $50,000 to scale up and purchase solar dryers, hot air dryers, automated packaging machines, and packaging materials. Thank you.
Thank you so much. We understand that we are pressed for time, and we need time to collate this, but we want to crave the indulgence of a group photograph with the panel of judges and the innovators. We are going to collate, please, can you make your way forward, the judges and the innovators, quickly, for 1 minute. And we are going to be awarding some prize money in the next couple of minutes, but we'll give time for some collation. And after now, they will come back later and be announced as either first, second, or third place winner in this innovation contest. Thank you so much for your time. I will hand over now to Coyote.
Thank you very much. Let's put our hands together for this brilliant innovators. Such brilliant ideas, and I can tell you that the future of our nation is bright with these bright minds. Thank you very much. So the judges can quickly join them for photographs as we switch gears now. Your Excellencies, distinguished guests, ladies and gentlemen, this is day 2 of Agenda and Inclusion Summit 2025, and I can tell you that it's been an amazing ride all through. But I'm excited to tell you that it gets even better. And I want you, everyone here, to give a GS25 special welcome to someone very distinguished who just joined us moments ago. So ladies and gentlemen, I want us to make welcome Nigeria's Honorable Minister, Federal Ministry of Foreign Affairs, Ambassador Yusuf Tugar. Thank you for joining us, Honorable Minister. You came just in time for the high-level plenary, which we're getting into right now. So without taking much of your time, I'd like to make welcome the Honorable Minister for his opening thoughts before we move into this high-level plenary on From Aid to Investment, Leveraging Economic Diplomacy for Africa's Inclusive Development. So ladies and gentlemen, let's make welcome once again